Hi there, fellow steady pacers, and welcome back to the MS Workouts channel. Today, I'm going to guide you through a few recovery movements that are going to help you have less tightness and spasticity in your hip flexors. This is the second part of a 4-part series that we are releasing this month on hip flexors. If you haven't watched the first part, then I included the link in the description box below this video. Before we begin the recovery session today, I want to make sure that you know, at MS Workouts, we offer a premium subscription-based streaming service that lays out our science-based steady pace technique in a way that is tailored to your specific symptoms like foot drop, hip flexors, and weak grip, as well as so many more. So if you're ready to transform your body and reduce your symptoms using our proven science-based technique, then go to www.msworkouts.com to sign up and/or learn more about it. Movement drills. If you've been around our channel for any time, you realize that when we're moving, that's all we're doing, okay? The intensity is gonna be down, it's gonna be low. We're not recording this, we're simply trying to get blood flow back to the body. So the first movement that we're gonna hit is an active march. Notice I have the band or a towel or a shirt, something underneath if you need it, and we're literally just going to march. So you're going to pick leg up. Notice it is pretty slow and controlled, head back down. And what we're doing in this movement drill here is we're looking to drive blood flow to the hip flexor, okay? And shorten and lengthen that tissue. It's gonna help reduce spasticity, tightness. It's also going to help the recovery process from that higher intensity exercise that you've already hit to allow you to develop the very best results. Because remember, the results don't come during the exercise session, they come between the exercise sessions, and this is gonna help you supercharge that recovery. So when you're executing that march, use an assisted band if you need to. The suggestion is anywhere from about 30 to 45 seconds. Give yourself a little bit of a rest. 30 to 45 seconds, give yourself a little bit of a rest. You can go 3 sets if you want. No need to really do more than that. You could do these multiple times throughout the day, but make sure you're executing these because it adds specificity to your active rest. All right, let's hit that second movement drill, which I would really suggest alternating these. So hit the march and then go into this one because this is what we would call an extension and flexion of that hip, okay? The extension, you're gonna see here in a second, is gonna really help lengthen actively in that tissue, which is gonna feel really good in opening up your hips and getting blood flow to the area. So, I'm gonna turn my chair a bit here so you can see from the side angle view. We're going to scoot to the side of the chair, okay? We're targeting this left side first. Notice I'm just dropping my knee straight down, okay? What you're going to do to begin this movement drill is you're just simply going to, and if you need to assist with your arm, please feel free to do so, slide that leg back, okay? The femur, right, which is the bone here, slide it straight back as you extend. Notice the hip flexor here is going to be lengthened and extended. You're going to kick back as far slowly as you can. You can even lean back with your upper body, torso some, to help lengthen that anterior side, and then slowly head back the other direction. Now the key here is to make sure you're bringing that femur or that hip through a full range. So go ahead and use the band or the hands if you need to, bring it all the way up, as much flexion as you can, and then head back down the other direction. As you head out, we're lengthening, opening that hip up, right? Use the hand if you'd like to, okay? Lean that upper body back, get a good active stretch in. We're not statically stretching, so we're just dynamically moving the range, so don't go to a static position or a certain position and hold, okay? Move through that range of motion anywhere from a good 5 to 8 times, depending on how quick you're doing it. Try to go slow and deliberate. Again, I only need about 30 seconds to 90 seconds of movement in that area to drive the blood flow there. Make sure you're executing this on the left side and the right side. So that second movement drill, that hip extension and flexion, is going to be 2 different sets. So I'd highly recommend you begin with the march, then go to a hip extension, hip flexion, then go to the opposite side. You can alternate. Again, execute these 2-3 times a day, spreading it out, right? A lot of PTs, OTs will suggest morning time, midday, and then in the evening before you go to bed. utilize this tool because it's going to allow you to recover with much more specificity, as well as increased oxygenated blood flow so that you're developing the very best results possible. If you haven't, hit the like button, subscribe, share it with your friends, msworkouts.com. Make sure you're executing the exercises that we did before, and I look forward to continuing to build on this knowledge and information so that you can execute exercise, active rest, and have a schedule on a weekly basis that allows you to develop the results that you want and decrease those symptoms that you hate. Have a good one. I'll see you next week. Our YouTube channel is a great place to start gaining strength. But if you want to get serious about reducing your symptoms and getting results, then you need to be on a weekly structured strength training program with other individuals just like you. And that's exactly what we offer at MS Workouts through our membership. Click the link in the video or below the video to learn how our membership can help you achieve your goals. And while you're on the website, make sure you sign up for the no-cost 7-day strength camp so you can experience how we can help you do the things that you love to do with more confidence. See you all next week.